Everybody, it's Dan Sfera
Don Walters.
and we are the Clinical Trials Guru, and that's www.theclinicaltrialsguru.com. Now, I had an interesting question posed to me by someone. I won't mention the name because I don't know if they want to be identified. But basically, they're asking, hey, since you work with so many doctors, and you've seen doctors wear many hats, some may be study doctors, and then some may also do private practice. So what this guy was asking me was, what have you noticed as far as doctors, how they interact and treat their patients, whether they're study participants or their own patients from their private practice? How are their interactions different? And do they treat them with the same amount of respect? Um, do they treat them the same way? Are the study patients being given therapy? Are the private practice patients always being screened or pre-screened for studies? What have you noticed? And I'll let Don answer that question first, and then I'll throw in my 2 cents.
I think where this question probably derived was from a video we did earlier. And that video came from a statement that a very highly functioning client told me that the doctor was basically inappropriate in front of him. I won't go into details, but it's in the other video that we did a few segments ago. I think it's not such a black and white answer you can give because it depends on a lot of things. I think, first of all, it depends on the clinician themselves. If they're ethical people, then they're going to approach, whether it's the private practice or research, going to approach it in an ethical manner and deal with their clients in such way. Now, the other thing depends on the condition that doctor's put up under. If you're an unethical doctor, if you're in a situation where, let's say, you're getting paid on an hourly basis from that research study, you may not want to give those patients as much attention, or you may not want to see as many patients. You want to see as little as possible, and so that you can get your money regardless, or not see anybody at all, or just do enough to get by. And then your private practice, obviously, you have to see patients to get paid, so then you're going to make sure that those patients are taken care of. But I don't think there's my personal opinion, I have not run into a lot of doctors like that. I think a lot of doctors are going to deal with it accordingly, because in private practice, obviously, the patients, there's more involved. What I was told by a few doctors is that private patients, there's a lot more things demanded on them than in research. Where in research, if they can separate themselves from treatment and actually do what's supposed to be done and what's required for research, you're there to collect data. You're there to do the work, follow the protocol, and collect data. Of course, then you still can't throw out bedside manner, because if your bedside manner is out the door, then a lot of times your data is illegitimate. I think that's going to be the difference in that situation. It all depends on the doctor, depends on the environment that they're put into as far as them earning their money, and whether or not they're really looking at research for what it's supposed to be looked at.
And okay, so ultimately the question is, how does a study doctor treat his study participants as compared to his private practice patients? And for those of us, because we live in a politically correct society, the quick answer is to say the same, but that's not the case, because in research, if you treat your participants as if you're treating your own patients from your private practice, as far as helping them recover or giving them some kind of therapeutic benefit for just speaking with you, or giving them anything like counseling or therapy, that may skew the results of the study. And one of the important things that drug companies always tell the doctors is to separate from placebo as best as possible. Even though we don't know what particular medication the study participants taking, we don't know if they're receiving placebo or not, because it's double blind. A trained investigator should be able to separate from placebo, and then the data becomes more reliable, and the data would go ahead and kind of prove that the drug works. So if you're providing therapy, if you're providing too much therapy to your study participants, you may not be separating from placebo. Even if they're receiving placebo, they may be getting better because they're interacting with you. And this is especially true in psychiatry. Now, there's a fine line, because if you treat all of your study participants, like their numbers and subjects instead of human beings, you may not get them to come back for the second visit,
Exactly.
for the third visit.
Very good point.
So that's what I got to say, and hopefully this didn't turn off. No, it's still recording. So anything else you'd like to add, Doc?
No, I don't want to extend it too long, but again, to summarize, the whole thing is that, again, there are some doctors, I think, that do good work out there and that really care about what they're doing, and there's some doctors that don't, and they don't care how they come across, and they're only looking at the money aspect and how quick they can get their money and get out the door.
Mm-hmm.
That's pretty much it.
I love the question. I'm sure it was asked before, but it's never been answered online as far as I can tell, and I've Googled it and I've tried to find the answers. So we're trying to do our best to kind of shed some light on this topic.
Definitely. So we're going to sign off at this point. Any further questions, you can contact us at www.theclinicaltrialsguru.com. We'll see you later.
See ya. Thank you.